Welcome back into Talking Fitchburg, everybody. Hope you're having a wonderful day out there. We certainly are here. We are here with one of my favorite favorite guests. It's Jeff Doslick from Fitch-Rona EMS. How are we doing this morning?
I'm doing great. Good morning.
What do you think about this? You're our first test subject for coming outside and doing a segment.
That is awesome. So I was thinking when I was back behind the camera, are we going to do this in December and January as well? I mean, that would be awesome.
Well, if you want to come out here and be by yourself, I'm more than fine with that. And I would just speak for Preston, too, that he'll probably want to stay inside and stay where it's warm.
Right.
Yeah, smart Alec. That's what we got here this morning. All right, on a serious topic, though, I asked Jeff to talk a little bit this morning about, let's talk about overdoses a little bit. It's still a big crisis, not only here in Wisconsin, but throughout the U.S. And so I thought generally today we could talk a little bit about where some of these overdoses are coming from, and then if you come across somebody with an overdose, what should you do prior to you guys getting there? So let's just start off here with prescription opiates, the most common drugs involved in prescription opiate deaths. And maybe I'll have you talk generically. We've got some graphics to put up.
Sure.
Just overall prescription.
Sure. So a lot of people think that overdoses come from, the heroin user out on the street, and that's not necessarily the case. You look at incidents of Brett Favre, for example, was taking hydrocodone and had a prescription drug issue. So a lot of the overdoses that we see do come from people that are just taking over-the-counter or prescribed medications and happen to take too many of them or become addicted to them and then wind up having an issue. And they're much like heroin, the same signs and symptoms that you might see with a regular heroin overdose or a fentanyl overdose. We'll treat it the same way.
Yeah, and it says here on our graphic that in 2014, nearly 2 million Americans either abused or were dependent on prescription opiate pain relievers. So definitely a big crisis, and I'm sure those numbers have doubled today.
Yeah, I think since 2007, the last 10 years, prescription overdoses has gone up almost 200%. So, it's easy to take a few pills when your back hurts and things like that, and if you're not paying attention or you're not really under the care of a doctor anymore, then you have an issue. And one of the things I think that we see is that, you're prescribed a medication, you put it in the cupboard, and it sits there for a while. You're like, oh, my back is better. And then, you have a little bit of an issue on your shoulder and you take a little bit more, or somebody in the household gets a hold of them and then they start taking them as well.
Yeah, very unfortunate, very addictive drug. Another one that's a little bit more stronger is fentanyl. Experience with fentanyl in patients.
So fentanyl, we do see fentanyl quite a bit with some of the patients, especially when we go to nursing facilities and they might have pain management, so they'll have a fentanyl patch on. And we do look for those things as well. But again, it's one of those drugs that's out on the street. They cut the drug with heroin, they cut the drug with other illegal substances, and it takes the potency from 100 times what it was to 1,000 times, such as in the carfentanil case, which we talked about a couple months ago. So we do still have some issues with fentanyl, and we're aware of those every time we go out on calls for overdoses.
I'm glad you mentioned, too, about the illegal use of it, because what we see here from our graphic is overdose deaths involving synthetic opiates other than methadone, which includes fentanyl, increased by 72% from 2014 to 2015. That's roughly 9,500 people died from overdoses involving a synthetic opiate other than methadone in 2015. So definitely a serious piece, and again, another really addictive drug.
Right. So if you look at a couple of the recent headlines, Michael Jackson was taking fentanyl and he died from a fentanyl overdose. If you're a big Prince fan, you know that was a drug that he was taking and he died from a fentanyl overdose as well. So it's something that's out there that's maybe prescribed for some pain over the counter, and we just happen to take too much or not pay attention, or it's used illegally.
And then finally, heroin, another big epidemic, again, throughout the U.S. and here in Wisconsin. And, of course, this is an illegal drug, but talk a little bit about what you're seeing there out in the field.
So we are still seeing an abundance of heroin out in the field. Because of the carfentanil and the heroin situation, we have upped our Narcan doses in the ambulance because of that. But we still see those cases where, patients are taking those drugs. They're picking them up illegally, and then they're driving somewhere and they're overdosing out on the street. They're overdosing in someone's house. There's been some reports of kids getting involved with heroin. I think there was a Milwaukee case not too long ago where there was a teenager, or even younger, I think, that got into some heroin and was revived by Narcan as well. So, those cases where kids don't know the difference, but they get into something at home that they shouldn't be getting into, and then we have issues with them as well.
Yeah, very unfortunate. And let's quickly here go to some of the signs and symptoms with somebody that may be having a drug overdose.
Yeah.
And we'll put up the graphic here. Tell us some of what you see
Sure.
as well.
So I'll just read it on the board here. No.
Yeah.
So overdoses, obviously, the biggest one that we see is going to be the constricted pupils for people that are on fentanyl, hydrocodone, the heroin. They'll have chest pain. They'll have unsteady gait. So they may, you may see somebody just kind of wandering, not normally walking like they would. You have patients that are unresponsive, unconscious, and, in some cases they do become violent. So, the people that are taking heroin illegally are doing it for a reason, and they become violent when you try to intervene with them. So one of the things that we ask the general public is really do scene safety. When you're going and you're observing something like that. So if you see a car pulled over on the side of the road and you see somebody that might be unconscious, we really suggest that you don't go up and start shaking the patient. Back in the day we could do that, but with the advent of carfentanil, just a little bit of that on your own skin, can cause you to have a reaction as well.
Yeah, and you don't know about sharps. You don't know. I mean, there's just a lot of factors there that you can't know. And it should be known, and it was on our graphic there, that not all these symptoms are atypical. So somebody could present with something different. Hard to say, but overall, if you see something that doesn't seem right, obviously we got to start 911 right away.
Right.
And quickly, let's just talk about what to do if you do find somebody in an overdose scenario. And of course, we're going to start with number one,
Right.
Call 911.
Call 911. That's the most important thing that you can do. If you're able to, and you sort of have a history of what's going on, you check breathing. You can just feel for a pulse in their wrist, so feel for a heart rate. But if you're really unsure, really just kind of be careful around what you see, because you really don't know what could be happening. Again, patients can become violent and you can get injured. We've had a couple of cases here in the past year or two where we've had overdoses in cars, where a car might be parked. It's still in park, so try not to stand in front or behind. Sometimes it's best just to observe, call 911, and direct the responders into the situation. But if you know the situation, you can put them on their side in case they vomit. We call that the rescue recovery position. Try to get as much information to the responders that you can. And then, if you need to provide some sort of rescue breathing because you know what's going on, do that as well.
Awesome. I think great tips. Again, hopefully you're not running into this, but again, it is kind of a bigger crisis out there. You could run into somebody that's unresponsive. Something could be an overdose, could be something else.
Right.
I think big thing take home here is there's many different forms of what overdose could be, and again, get 911, get you guys going, and what we can do is keep educating.
Right. Yeah, I think the thing is we, as responders, usually kind of look at the illegal stuff, but there is a lot of times where that's really not the case, and it's accidental, and you can do some of those things for your loved one that we talked about, provide breathing, and and worst case scenario, do CPR. If you need to do CPR, do just the chest compressions.
Perfect. We got to take a quick break. Coming up next, we're going to introduce you again to this brand new ambulance back here. Jeff joins us for another segment. Stay tuned. It is Talking Fitchburg.